Dr. Faulkner from Harry Medical College, and the issue is diabetes and kidney disease. And of course, Dr. Faulkner, let's give you an opportunity to talk about diabetes and perhaps give us what you might consider a checklist in terms of the impact and the effects that this disease has upon individuals.
Well, once you're diagnosed with diabetes, then there are several things that you must keep up with. One is your cholesterol. You should get it checked every year. Another is your eye exam. You should get that checked every year as well. Then as it relates to your blood sugar, your hemoglobin A1C, you should get that checked every 6 months. If it's not controlled, every 3 months until it's controlled. So there's several things you need to check on. You also need to check on your kidneys, and that's the main reason why I'm here, because your kidneys should be checked on every year as well.
And so the kidneys is very intimately associated with diabetes.
Oh, yes. Oh, yes. Diabetes affects every organ in your body, your brain, your heart, your kidneys. It just affects just about every organ in your body. If you don't check your diabetes and it gets out of control, then you start to lose protein in your urine. And once you start to lose protein in your urine, after about a 10-year period, you could end up on the dialysis machine or kidney machine.
And talk about the kidney machine or dialysis. What's the process in reference to that?
Well, dialysis is a form of renal replacement therapy. Renal means kidney. So it's a form of therapy that we can use to substitute your kidney. Of course, it is not 100% like a human kidney, but it maintains your lifespan, and it gives you an opportunity to wait on a kidney transplant.
Now, I understand that this is a very, very expensive proposition, these dialysis and whatever. Talk about that as a cost that might be associated with kidney disease.
Oh, yes. Dialysis is very expensive. It can cost from $35,000 to $50,000 a year per patient. And there are about 450,000 patients on dialysis across the United States, so it is a big part of what the government spends to take care of a patient who has kidney disease.
And anything that could be done in order to decrease the number of individuals who might be impacted by this disease will help not only individuals, but will help the national government and help the governments as well.
Oh, yes. Oh, yes. Anything that can be done. First of all, if you have diabetic kidney disease, what you need to do is make sure your blood pressure is controlled. Make sure your blood sugar stays under control. Make sure your lipids or your cholesterol stays under control. Those things can help you decrease your progression of kidney disease and increase your lifespan as well.
And so it's really an individual decision that can make all the difference in the world in terms of how they might be able to respond to the treatment. Is that it?
Oh, yes. Oh, yes. The better you respond to the treatment, the fewer doctor visits you have, the decrease in the cost of your care. It is amazing what can be done if the patient works along with the doctor to help treat the diabetes.
Well, what have you found in terms of dealing with patients to be some of the real reasons that people don't do what they're supposed to do as patients? I know that, you know, you see people every day and you've told them to do this or do that, and et cetera, but yet still they're not doing what they're supposed to do. What are some of the reasons that they give to you in reference to that?
Well, you know, a lot of the medications are expensive, and a lot of patients don't have insurance. And so that impacts what the patient does. Sometimes the patients don't understand exactly what the doctor is telling them, and they need more educational information about their diabetes. A lot of times the patients might not take you as seriously as you would like for them to take you when you're talking about monitoring their blood sugar. You know, patients with diabetes have to monitor blood sugars many times during the day to make sure that it stays under control. And of course, in your normal routine while you're working, if you have to monitor your blood sugar 4 times a day, 3 to 4 times a day, it's very difficult to work all day and then do the things that you need to do to monitor your blood sugar and give yourself insulin and so forth.
Now, there are some occupations that you would probably have a difficult time dealing with if you do have some problems with kidney disease or diabetes. Is that so? I mean, you can't live a normal life in a real sense if you've got chronic kidney disease, can you?
Well, now you're talking about kidney disease as opposed to just having diabetes. Kidney disease, yes, there are some things that you cannot do, depending on the type of renal replacement therapy you accept. If you want hemodialysis, of course, you have to go to a dialysis facility and dialyze 3.5, 4 hours, 3 times a week. If you're talking about peritoneal dialysis, well, you do that on a daily basis. You either do it 4 times a day during the daytime, or you do it at night with a cycler. 90% of the patients in the United States do hemodialysis. Only about 10% do peritoneal dialysis. So the majority of the patients go to a center.
But there are those individuals who are actually tied to this machine as almost 90% of their time. Is that what you were saying?
No, not 90% of the time. I'm saying about 3.5 to 4 hours, 3 times a week.
That's a considerable amount of time.
Yes, it is a considerable amount of time. Yes, it is. And a lot of patients don't feel as well as they would like to feel when they come right off the machine, so that takes a little time to get their energy level back up. So it does take quite a bit of your time during the day.
Well, now, is there some kind of preventive thing that you could say to people who might later on fall into a situation where they have to come to a center or wherever 3 times a week, 4 hours at a time, and et cetera? What can you say to people who might be going down that road? I mean, you certainly, you know, by dealing with them, you can see the progression that this disease is having on them. What can you say to them to make them understand that unless they do check their situation, that that will be the ultimate outcome?
Well, one thing is that monitor your blood pressure. Make sure your blood pressure stays normal. Diabetics have to have a normal blood pressure. 120/75 is the optimal blood pressure for them. Make sure the blood sugar stays under control. Make sure the cholesterol is under control. Those things will certainly help to decrease the progression of kidney disease. Now, there are some medications that we use, angiotensin receptor blockers, angiotensin 2 receptor blockers. We use those to help decrease the impact of diabetes on the kidney. Also, we use angiotensin converting enzyme inhibitors, which we call ACE inhibitors. A lot of patients on those medications, and those 2 medications help to decrease the progression of kidney disease.
But now, of course, as we get ready for this second commercial break, Dr. Faulkner, it can be said that if individuals do have these problems and they can't get the medication, then it's almost impossible to deal with the real problem without the medication. Would that be correct?
Well, the medications are very cheap, so now you may be able to deal with it a little better than when they first came out.
Very good. And of course, we'll be back with our audience following this very, very short commercial break. We're talking to Dr. Faulkner from